Good evening, everybody. Thank you so much for joining us this evening. It's really a pleasure to welcome you to our town hall meeting. My name is Faris Sabah. I am the County Superintendent of Schools, and it is really a pleasure to be joining our community to talk about the expansion of in-person services for all of our Santa Cruz County public schools and our charter schools. I'd like to cover just a couple of logistical items before we get started. This meeting is going to be recorded and posted on the Santa Cruz COE website and social media for public viewing. We just wanted to make sure you knew that. También me gustaría anunciar que si desea escuchar la presentación en español, presione el icono del globo y seleccione Spanish para escuchar la presentación en español. So we have Spanish interpreting available for our Spanish speakers. We welcome questions, and we have a Q&A feature, a question and answering icon that you can click on. That will allow you to ask questions. We're going to do our best to answer your questions out loud or in the answer section by chat. We're going to be answering questions at the end of our presentation. All right, so as you know, last week, Santa Cruz County entered the moderate orange tier on the governor's blueprint for a safer economy. And while we're eager to resume in-person instructional programs to the fullest extent possible, we approach this with a sense of cautious optimism, understanding that we must have physical and logistical processes and procedures that have to be in place as we increase the services we offer to our students in person. We have a diverse community of school districts, and we have unique needs that have to be met before students are welcomed back. We're grateful that our local health conditions are improving to allow us a path forward for our schools, but we're also aware that national COVID-19 conditions have worsened, and if we're not vigilant in our efforts, we may see an increase in community spread, especially with the holidays and winter approaching. We continue to work closely with our Santa Cruz County public health officials to monitor data and local health conditions, and we'll be prepared to shift teaching models if necessary. The safety and well-being of our students and educators and families remains our top priority as we make decisions to return to in-person instruction. We miss our students and our families, and we know that this has not been easy. The transition to distance learning has been a huge challenge for our families. And just like COVID-19 has disproportionately impacted our most vulnerable families, so has the transitions and the challenges we face in our schools. I want to thank our community partners for collaborating and thinking outside the box on behalf of our students, and acknowledge the board members of all our school districts and charter schools, Santa Cruz County Public Health, and our union leaders for their persistent and ongoing effort to keep our community safe. Educators have never seen a crisis of this magnitude in our lifetime, and it is our strong partnerships that have helped us navigate this especially challenging time. Thank you for your leadership, your guidance, your support, and your encouragement. Our teachers, our classified staff, our administrators are doing an outstanding work, and we're extremely proud of our community and the work that our school leaders are exemplifying to ensure our students come first. We come together as a school community to share with you our plans and moving forward. I'd like to take a moment to ask our leaders to introduce themselves. And while only some of them will be speaking today, we're available for questions and answers that you may have. I'm going to ask us to start with Lori Bruton.
Yes, I'm Dr. Lori Bruton. I'm the superintendent of San Lorenzo Valley Unified School District, and we serve about 2,500 students in the Valley and then another 2,500 in an independent charter school.
Good evening. I am Kirsten Carr. I'm a director with Watsonville Prep Charter School. We are part of the Navigator Schools public charter school system.
Hello, I'm Dr. Lori Chamberlain. I'm the superintendent of the Live Oak School District. We serve students from pre-K to 8th grade in Live Oak. Approximately 1,600 of our students attend our schools.
Hello, I'm Alicia Doolittle. I'm the director of Lynn Scott Charter School in Watsonville.
Hi, I'm Jen Renan. I'm the principal of Delta Charter High School.
Hello, I'm Eric Gross. I'm the superintendent of Pacific Elementary School District in Davenport. Good evening, I'm Mike Hefner. I'm the superintendent for Bonnie Doon Union Elementary School District.
Good evening, I'm Tanya Krauss, superintendent for Scotts Valley Unified. Good evening.
Hi, thank you for joining us. I'm Michelle McKinney, superintendent, Happy Valley Elementary School District. Thank you for being here.
Hello, all. Honored to be here. I'm Diane Morgenstern, the superintendent from Mountain Elementary School District, serving students TK through 6th grade.
Good evening. I'm Chris Monroe, superintendent for Santa Cruz City Schools. Thank you for joining us this evening.
Good evening. I'm Jennifer Proudfoot, the principal of Tierra Pacifica Charter School in Live Oak.
Hello, I'm Dr. Maria Raitano, head of school at Pacific Collegiate School in Santa Cruz. Thanks for joining us.
Good evening. I am Josh Roop, the head of school at Saba College Prep in Watsonville. Thanks for joining us.
Good evening. I'm Dr. Michelle Rodriguez, superintendent at Pajaro Valley Unified School District. Thanks for being here tonight.
Hi, everybody. I'm Scott Trimble, the superintendent of SoCal Union Elementary School District. Thanks for being with us tonight.
And hi, everyone. I'm Mimi Hall, and I'm the County of Santa Cruz Health Services Agency Director. And I wanted to thank all of our school partners for inviting me here tonight and working with us through all of this.
Thank you so much, everybody, for joining us. We'd like you to see as our community that we have come together as a school community to speak with you about our plans for expanding our in-person services, that we are speaking with a common voice on behalf of our students in advocacy for both the best best educational experience for our students, as well as the safe and well-being of our school community. Today, we're going to be talking about a few things. We're going to be kind of setting the stage, and we're going to talk about some criteria that we are utilizing to move forward with our plans for in-person services. And we'll also talk about our path ahead, and then we will be opening it up for questions as we and try to our best to answer all of your questions tonight. Again, thank you so much for joining us. I'd like to ask us to start when it comes to discussing setting the stage. Dr. Raitano, would you like to start, please?
Absolutely. Thank you, Dr. Sabah. I'm Maria Raitano, as I said, head of Pacific Collegiate School, which is an independent charter school that serves students in grades 7 through 12 from across Santa Cruz County. You'll note in our presentation this evening that we do not use the term reopening of schools in our plans. This is done very deliberately. We don't talk about reopening our schools because our schools have continued to be open during this pandemic, delivering instruction and services through distance learning, food services, mental health, and other student support services. And further, we see the transition to in-person services as a gradual process. First, by working in person with groups of students who have particular needs or who have been unsuccessful with distance learning, and moving eventually towards hybrid instruction while adhering to our health and safety protocols.
So once again, good evening. I'm Dr. Michelle Rodriguez, superintendent of Pajaro Valley Unified School District. And with more than 20,000 students living in a district that spans from Aptos to the northern part of Monroe County, we represent the largest school district in the county. And as we look towards a return to in-person instruction, it is important to acknowledge the multiple factors that determine readiness. And that includes doing our part to complete a thorough risk assessment of our facilities, consistently monitoring local health conditions, and including stakeholder voice in our process with people of multiple perspectives. And so our school districts have made great strides to increase connectivity, customize learning, provide food services, deliver mental health services to our students. However, we recognize that distance learning continues to be a large challenge for many of our students, especially our vulnerable students who are language learners, students with disabilities, our students from low-income families, and our students experiencing homelessness. While we miss our students tremendously, we want to bring them back to school to provide equitable learning environments for all. And we must also approach a return to in-person instruction cautiously to ensure that we do not unintentionally spread the virus in our community. And so we're partnering with the Santa Cruz County Public Health to proactively implement and follow California Department of Public Health guidelines, which is the core of our approach moving forward.
Hello, once again, I'm Diane Morgenstern, the Superintendent of Mountain School District, a small single school district located at the gateway to the woodlands above Soquel Village. As we look forward towards a return to in-person instruction, there are two key factors every Santa Cruz County School District uses as our criteria. One, readiness systems, and two, health conditions. These criteria are crucial systems that must be in place to prevent and minimize the spread of COVID-19 in schools should outbreaks occur. Criteria 1 readiness systems includes surveillance testing, surge testing, school environmental reviews, contact tracing, support of the school community, and working with parents, students, and staff. Criteria 2, health conditions, addresses county risk level, local epidemiological conditions, and exposures, clusters, and outbreaks. With regard to criteria 1, in order to increase in-person instruction at this time, we must follow the California Department of Public Health guidelines and ensure COVID-19 surveillance testing for school personnel is fully implemented countywide. This means all districts, charter schools, and private schools in Santa Cruz County who will be offering in-person services must participate in surveillance testing to minimize the risk of COVID-19 transmission. We thank the Santa Cruz County Office of Education for launching a new surveillance testing system in partnership with the highly esteemed Stanford Healthcare and with partnership from all of our school districts, charter schools, and private schools. Thank you.
Hello, I'm Tanya Krauss, Superintendent of Scotts Valley Unified. We serve around 2,400 students in grades transitional kinder all the way through 12th. We have 4 schools, 2 elementaries, 1 middle, and 1 high. So thank you all for joining us this evening. In criteria 1, as Superintendent Morgenstern mentioned, all school site safety protocols must be reviewed to ensure that the physical environment is compliant with all COVID-19 safety precautions. Schools countywide have conducted initial reviews of all protocols utilizing standards developed from the California Department of Public Health and the Center for Disease Control Guidance. This review included the modifications to the school environment. We must conduct final on-site reviews of each school protocol prior to welcoming back in-person instruction. We must also ensure our contact tracing is in place and have partnered with local public health offices to establish clear roles and protocols to respond effectively to any cases that emerge within the school community. Important to this process is supporting our school community. There continues to be a deep concern among many groups of teachers, classified staff, families, students, and members of the community about the risks of expanded in-person services. We will continue to work collaboratively with our boards of education, our labor partners, and families to ensure that stakeholder voice is heard.
Good evening. I'm Chris Monroe, Superintendent of Santa Cruz City Schools, a school district that represents 13 schools serving more than 6,200 students. Our district serves families from Aptos to Bonnie Doon. The second criteria that we'll be sharing tonight as we work to expand in-person services and instruction addresses local health conditions that we are diligently monitoring. We are grateful to everyone in our community for doing their part to follow safety protocols and keep our citizens healthy, which allows us to move towards opening up our county. Our schools will continue to partner with Santa Cruz County Public Health authorities to monitor local epidemiological conditions, including monitoring cases and trends, so that we can identify potential hotspots and develop mitigation efforts to address them. If our mitigation strategies repeatedly fail to contain exposure, clusters, or outbreaks within a school or a district, the district and public health may consider decisions to reduce or suspend in-person services. However, with these systems in place to closely monitor spread of the virus, we have a plan to safely increase our in-person services for our students.
Thank you, Superintendent Monroe. As you've heard, significant progress has been made in securing the readiness systems to keep students, families, and school personnel safe when in-person instruction expands. In the coming weeks, several school districts will welcome our highest needs students to our school campuses to offer in-person in small cohorts. Our plan is to expand in-person services. This plan to expand in-person services was integrated in our updated guidelines for the redesign of schools that was released on Friday. This document can be found on the santacruzcoe.org website, and there's a direct link there, sccoe.link/guidelines-1030-2020. Within this document is a diagram that details our transition from distance learning only to small cohorts to hybrid learning. The details of how each district and charter schools will implement these general parameters will vary at each school community as each school community customizes instructional models that work for them. Our schools have made significant progress in moving forward towards to be able to have the readiness to have in-person services in place. And we're going to continue working through December 2020 and with the overall goal of moving toward a hybrid in-person instructional program in January 2021, as long as criteria 1 and criteria 2 have been met. This work has been done in conjunction with a variety of partners, teachers, classified staff, school nurses, community agencies, and perhaps most importantly, our strong collaboration with the Santa Cruz County Public Health. I'd like to welcome the Director of the Santa Cruz County Public Health Agency, Mimi Hall.
Thank you, Dr. Sabah. Can everyone hear me okay? I had to change audio devices. Okay, great, thank you. As Dr. Sabah mentioned, I am Mimi Hall, the Santa Cruz County Health Services Agency Director, and we serve as the local health jurisdiction, and our health officer, who is the County Public Health Officer, has legal authority over many matters having to do with COVID. When it comes to schools, it's the state, the California Department of Public Health, that provides the guidelines for schools, but we work incredibly closely both with COE and all of the school districts, and Dr. Newell has been a close partner with the entire group. For the last several months, our agency has worked with not only the state, but also the schools to prepare for a safer return of students to campuses. And they were months that were much needed. Remote instruction has been a really important part through the early months of the pandemic to a really important part of a broader set of strategies across the entire community. There is no one magic bullet solution to mitigating COVID. And so we appreciate the partnership of the schools and the sacrifices that all of you have made as parents and your students as well. Now, after these months of preparedness, we have learned a lot more about COVID transmission and how it transmits in our own communities. I encourage you all to go to our county website, santacruzhealth.org, and look at our data dashboards about COVID and its spread in our community, because you can see that it's inequitable. And there are some communities and also some demographic groups that are disproportionately impacted by COVID. And this is the kind of data and information that we share regularly with the schools as they make their decisions about reopening. We also, as a county and as a state, have dramatically expanded our ability to test, our lab capacity, our contact tracing capacity, and all of this was much needed planning that the last several months have brought us. So as I mentioned, under the governor's executive orders, it is the California Department of Public Health, the state health department, that sets the guidance for the schools. But it's our commitment to work in lockstep and hand in hand with the school community to provide the guidance and the support that they need so that they can meet the criteria outlined by California Department of Public Health. We want to show a great amount of appreciation to the County Office of Education, all of our school districts and our charter schools and other partners, because they have really worked hard to be thoughtful and prepare for safer school environments. And we stand in partnership with them as we go through this journey over the next several months, and they move forward with their plans to increase in-person services. I want to close by mentioning that it is true, Dr. Sabah mentioned that COVID is increasing across the county. It's also more recently increasing in areas in California. So our statewide test case rate has gone up in the last 2 weeks, and I believe the governor will talk about that during one of his press conferences this week. So COVID is, it's not a straight line. Dr. Newell, our health officer, likes to say there are several waves that we're riding. And all of the preparedness that the school districts and the County Office of Education have done are preparing for us to ride these waves together and respond based on the best we know in terms of science and medicine, but also what's also good for our families and children. Thank you.
Thank you so much, Director Hall. And thank you to all the superintendents, the charter school leaders, everybody that's come, and all of you who have joined us today to listen and participate in this conversation. We'd like you to ask all of you that if you have questions at this point, to please use the Q&A feature, which you'll see the Q&A at the bottom of the Zoom screen, where you'd be able to ask your questions in the Q&A box. That we're not using the raise your hand feature for questions. We're asking folks to put their questions there. And we're gonna start going through those questions at this point and do our best to answer them. Some of them we'll be answering in writing in the answer, and as many as we can we'll be able to answer out loud. One question here: many private schools in Santa Cruz County have been open for in-person instruction for many weeks now. Some are richly funded, others are on a shoestring budget. What lessons can you learn from your colleagues at these schools? We work with our private schools. I meet with them on a weekly basis. We have been monitoring them very carefully as they moved quickly to open once they were able to do it under the governor's plan. And one important thing I think to keep in mind is that most of the private schools that have opened up have a very small class size count, which resembles the small group cohort model with small groups of students in the classes. We have been partnering with them to make sure that they are participating in surveillance testing. They're going to be participating in making sure that they are ready for surge testing. And we are talking to them about different models that they've implemented as well. And so I think that this partnership is something that has been a great collaboration. However, their reality, their structures, their resources are very different than many of our public schools. I think that having a classroom that has 8 students in them, for example, is very different than some of our schools where we have a much larger number of students, and our structures and so there are some things we can share resources and information. At the same time, I think they're kind of apples and oranges in many ways. I'd like to move forward with some additional questions, and I'm going to ask Sage to help me with those. One question here is, what are the thoughts of the teachers unions when it comes to moving forward when it comes to our reopening plans? And I would like to say, and I'm going to open it up to any of my colleagues, that part of this process, and you heard it, I think, in some of the comments from the superintendents, that we have to work together as a school community for this process. And this is a fundamental part of our public school system, is that we work with our leadership, we work with our labor representatives, and we want to make sure that we are listening to their concerns, that we are engaging them in the process, and as we develop the solutions to ensure the safety, to minimize the risks for our community, that they are key partners in these conversations. And I believe that each of the folks that has spoken tonight can talk to you about how they have been working with their labor representatives as part of the process and involving them in the plans for us increasing in-person instruction in the future. And so I don't think there's a simple one-word answer to say that our teacher unions think a certain way, or that any of our labor partners are, but I do think that you can hear our assurance that we are involving them in the process and communicating with them in developing our plans for increasing our in-person services. Is there any of my colleagues that would like to add anything to what I just said?
So I'll just add on to what you said. What we know is best for our students is when we work together, united on the common purpose of providing the best instructional program we can. And so for PVUSD, I am proud of, there's approximately about 100 of us who are in different subgroups working on not only the plan that came out that allowed for the modifications of the current distance learning, but also the plans for January for additional in-person instruction. And so us working together will allow us to ensure that when we do come back, that we come back, not only focus on the health and safety of our students and staff, but ensure that system inequities are addressed and that we're all prepared and comfortable to continue that work together because we all are here in service of our students and our community.
Thank you so much, Dr. Rodriguez. Here's another question. What will hybrid instruction look like for middle school and high school students? Please go ahead, Superintendent Monroe.
This is Lori Bruton from San Lorenzo Valley. I would say that each high school district is working on a hybrid schedule. We have several models, all of which are imperfect. And currently we are all working with our teachers union and our classified union to work together to come up with the most feasible schedules, and each school district will be sending those out. So if you're looking for like specifics on schedules or what it exactly looks like, it will be a half-day schedule for high school students, but students will still be going from class to class because, as you know, in high school and in middle school, it requires a specialist credential to teach mathematics and science and English and social studies. So our teachers are very, have specific credentials that allow them and authorize them to be teachers of that subject area.
Thank you. Superintendent Monroe, would you like to add to that?
Just that it's particularly complex to plan right now for a hybrid reopening because we're also planning to serve those students and families who are choosing to remain in distance learning. So we're working with all of our stakeholders, our union leaders, our teachers, our support staff, our families, and our students to design schedules that will meet the needs of everyone at this time.
Thank you. Question here is, we were told that small cohorts would begin in October. Have they started yet?
Yes.
Yes, they have in PVUSD.
I would say that in multiple districts are starting or in the process of planning to start. I think that, again, this is something that involves looking at what the school community is ready for, but we are committed to increasing those in-person services as we move forward. And that is really the reason for this town hall is to let you know that all of our districts and our charter schools are looking at these models and recognizing that we need to meet with the needs of our students, and many times that needs to happen in person. So there's a question about, can you explain what the actual plan is for in-person instruction? How many days, which cohorts? And I think that for in-person instruction, maybe we could talk a little bit about what in-person services are looking like right now with the small cohorts. And then maybe we could talk a little bit about the models for hybrid that we're talking about for January. For the districts that are implementing cohorts right now, what does that look like?
So for PVUSD, we have two separate set of cohorts that are happening. So we have what we call safe spaces. So those are cohorts of students. Now they're pretty close to the 24, so they're in groups of 12. In those settings, what's happening is the students that do not have access to the internet, or their internet is unreliable, or they need a quieter setting, they're able to come to those safe spaces. And so they're provided supervision, food support, administrative support. And then now we are also doing small cohorts for our special education students. And so that is continually gradual. But what we're looking at mostly is students who are not able to meet their IEP goals through the distance learning. And we're gradually bringing them back, not only with their teachers, but also with the support staff that includes the instructional assistants and also the behavior techs and all the other wraparound services that they receive. So that's our current small cohort model.
Thank you. So that is an example of what that looks like at this point. I think we're ready for a different question. All right. Are schools upgrading ventilation systems, as that appears to be a best practice around the country for successful in-person instruction? That is part of the recommendations or the guidance from the California Department of Public Health. And so all of our schools, as part of their protocol, are looking at their ventilation systems and following CDPH, the California Department of Public Health guidance. In many cases, we're looking at increasing the filtration systems for our schools, and also in some cases getting air scrubbers to and air purification inside the classroom. And so we recognize that that as much as possible, we want to have as much outdoor air coming in from the outdoors, and in some cases actually conducting instruction outdoors if possible. And so that is definitely something that we are looking at, and in our plans for the reviews of all our schools, those are some of the plans that our schools are implementing. Anybody would like to add anything to that? All right. Another question. Oh, yes.
I was just going to mention the interagency site evaluations that we did. So the team that included the County Office of Education, personnel from each one of our school districts did an interagency review of all of our sites. And so that really allowed us to see what we needed to support, including our HVAC systems. So I felt that was a really good process. We discussed it. I discussed it when I was speaking earlier today, but I feel the importance was not only that we had our own staff doing it, but we also had really fresh eyes from other agencies looking at our facilities as well.
Thank you so much, Dr. Rodriguez. What is a testing term you use, and what exactly does it mean? There are two terms that we used. One is surveillance testing, and the other one is surge testing. Surveillance testing is something that is part of the recommendations from the California Department of Public Health, where we evaluate, where we do tests for COVID-19 on a cyclical basis. So we basically put everybody on a schedule and test them for COVID-19 on an ongoing basis. And the requirement from the California Department of Public Health is that every staff member the 25% of the staff are tested at least every 2 weeks. And that is something that we mentioned that we have put in place with a partnership with Stanford Health Center. The other term that we mentioned was surge testing, and that's making sure that we have the capacity, if there is an outbreak, to be able to test everybody and get results very quickly. And that's something we also have a plan in place to ensure that if there is a positive case at the school site, that we would become aware of anybody who was exposed to that person, and we'd be able to test those folks to make sure that they have not, in fact, developed COVID-19. And I think those two pieces are very, very important for us to be able to not only anticipate, but also prevent and respond to effectively and minimize the risks to our school community. Okay. Okay, there's a question about school sports, and I will take that question. And this is something that is near and dear to many of us here on the call, and also to many of our parents, because a lot of the concerns and questions, and basically the concern is if we're able to, if our students are able to get back to school sports. And there is a specific set of guidance for youth sports that has been put out by the California Department of Public Health. And in that guidance, the California Department of Public Health says that we cannot share equipment, that we have to discourage that. And really the only kind of activities that are authorized at this point are conditioning activities for our students. And this is creating a lot of frustration and confusion also because there has been separate information coming out from CIF and other sources that imply that we are in fact authorized to be able to conduct school sports, but we have to rely on the California Department of Public Health. They are the authority when it comes to the health and safety of our students, and until that guidance changes, we have to follow that guidance. We are hopeful that the California Department of Public Health is going to be coming out with new guidance that will be able to clarify, if there's any flexibility. But at this point, if you read that guidance, it's very clear that we are not to share equipment, and it basically limits any kind of scrimmaging or any kind of activities that many of our students and our families would love our students to be able to participate in. And that guidance is included. If you go to our guidance document, you'll see links to that information as on the California Department of Public Health website. Okay, if you want your children, if this is a question for folks, if parents want their children to continue with distance learning, is that an option for them? Who would like to take that one?
I'll just say in SoCal that as part of our surveying of parents, we're trying to get a handle on the number of parents who would want that option. And so that then we can go about building programs and seeing what staff might be able to serve it. So right now it's just a matter of collecting the data.
I would also say for Scotts Valley that we are doing our very best to honor those requests as long as that we have staff available to fulfill those assignments.
At Pacific and Davenport, we surveyed our parents and over half of them want to continue with distance learning. So we will definitely be continuing to offer that option.
As will San Lorenzo Valley. We will offer an online option. However, teachers may change based on the number of students returning to campus. So we have to work with the staffing that we currently have. And so the student's schedule may change slightly or their teacher may change, but we will be offering online and in-person options.
Santa Cruz City Schools is the same as San Lorenzo Valley. We may have some teacher changes, but we will be honoring the requests of families to remain in distance learning.
In Live Oak School District, when we surveyed parents in June, about 10% of the families requested distance learning. We are resurveying our families in the next week to find if those numbers have changed, and then we'll be working with our staff to make those adjustments. And then we'll learn more about that, what it would look like depending upon the percentage requested.
And in PVUSD, we are committed to supporting parents, students, and families with distance learning if that's the option that they choose.
Great, thank you so much for that. Here's another question. Will students be tested for COVID-19? If so, at what point would they be tested, when symptomatic or prior to that? Our understanding is that we cannot require and probably do not want to require students to be tested as it is considered a medical procedure. However, it is something that we would encourage parents to do if there is a reason for that. And if a student has been exposed or potentially exposed, that is one of the recommendations that a physician would make to a family to have that done. There is news about LA Unified requiring it for students, and that's something that is in a lot of people's kind of one of the things that we're hearing a lot about from families. Where we see that testing for students would take place, possibly with parents choosing to do so, is if there is a situation where a student has been exposed, and that would be something that we would recommend families to be able to do that. And part of our surge testing model would be to make testing available for families to be able to get results very quickly within 24 hours, so that families would know if a student is, if the exposure has resulted in a positive COVID-19 case. And so that is, but it is not part of our surveillance testing, and it is not something that is being required or by the California Department of Public Health. Next question, let's see here. Is hybrid, will hybrid be mandatory, or can we, it sounds like, can we skip over and move right into full in-class instruction? The biggest limitation for that, of course, is the distancing requirements that are part of the guidance that we follow. And so having a large group of students indoors in a regular classroom would not be possible to implement. And that is why we have to do this hybrid idea of dividing the group into smaller groups that we would be able to bring in at different times, because it'd be impossible to be able to implement that in a classroom with the full class size. And so at this point, our understanding, and almost all the schools, public schools that have opened up in California are opening up in the hybrid modality. And so a lot of times we hear, oh, well, all these schools have fully opened up, and we hear that term fully opened up. Generally speaking, we reach out to those folks, and we've been talking to a lot of our colleagues all over the state, and virtually everybody is opening in a hybrid format, because that is the only way that we know that we're able to bring in all of our students, but at different times, to be able to make the class size small enough to be able to meet the requirements of California Department of Public Health, distancing requirements, and other safety protocols. Question, what will happen if a school facility does not meet the health and safety requirements? I think that's because if you heard loud and clear from everybody who spoke that safety is first. And so we would not want to put our school community at risk. And so that is why we've been working so hard and investing so much time and resources into making sure that all the protocols are in place. And so we wouldn't move forward with in-person services if we didn't feel like the environment was safe enough to do so.
There are a lot of questions in the chat
okay.
regarding the standards set forth by the California Department of Public Health for staff to be tested, 25% of staff to be tested every 2 weeks. What is the requirement in our county going to be for surveillance testing of school personnel?
At this point, we've established the same kind of minimum requirement. However, as we are gearing up to increase our capacity for surveillance testing, we are making folks, the ability for people to test more often as an option for folks. And so that means that as we are able to build up our capacity, we would be able to do a lot more than just the 25%. And so we don't have an upper threshold, but we recognize that surveillance testing, the more often it is, generally speaking, will result in better surveillance. And that's what this is about. And so we're continuing to work on increasing our surveillance capacity so that we can increase it to a higher level than 25% every 2 weeks.
Thank you. Have outdoor learning spaces been considered in this process to expand in-person instruction?
Who'd like to take that one? Superintendent Monroe?
Yes, we have been looking at how we can use outdoor spaces. We're currently holding our small cohorts outdoors. We partner with the County Office of Education, and want to thank Dr. Sabah for loaning us his outdoor educators to help us assess our spaces, look at how we can create outdoor learning opportunities. And our IT department has been expanding our wireless access outside to support those opportunities. We know that in inclement weather, that's not going to always be possible, but we are looking at ways we can provide learning outdoors whenever possible.
Thank you so much. Sage, you want to help me with more questions?
Yes. If in the event there is an outbreak at a school site, what is the process for notifying those who would need to be notified?
I'm going to ask Jennifer Busing to take this question for us. A process for notification for if there is a positive case.
Yes, hi everyone. I'm Jennifer Busing, our safety director here at the County Office of Education. And I am lucky enough to get to work with all of the school district superintendents and administration and our county health services with public health. And so there is a very clear system in place, and we're doing ongoing training for all of our school staff to make sure that they all understand how to do health screenings and how to report a concern of an exposure or a positive test. And so we're working on that communication and process. But if there is a positive test, likely it might be a family member that reports it to the school, and school would report that to public health. Additionally, the process is if there is a positive test, that test result gets sent over to public health as well. So hopefully we're trying to get the communication as soon as possible. And then as soon as someone learns of a positive test, it could be a day or two later, contact tracing begins. And the school will work with public health on that. And we are really lucky here in this county that public health has a special team assigned to work with the schools and the communicable disease unit, but also just for general information and creating these policies. So contact tracing would start to occur, and they would be looking at potential exposures at the campus for any students or any staff members. And then if family would be informed if their student or if they had been on campus, if they had been exposed, public health would reach out to them and begin that contact tracing process, recommending quarantine or isolation so that we don't potentially expose other students. And that might look like having to shut down a cohort or a classroom. And as soon as we have one positive case, we will be assigned someone with public health to look at that. And we will take all precautions to make sure that we don't keep classrooms open and continue the spread.
Thank you so much, Director Busing. We'll take another question. How will districts be supporting teachers who are also parents? Will they be given an option to continue delivering distance learning so that they can support their own children? Anybody like to take that one?
I would add that many school districts right now are allowing our teachers to bring their children to school campuses and attend their school online in their classroom. Also in Scotts Valley, teachers have choices to provide instruction from home as well. So whether they choose to work from home or from their classroom, they are able to bring their children onto campus. We are still in discussion in our negotiation conversations around a hybrid setting.
I'll just piggyback on what Ms. Krauss said, in that we offer the same option in SoCal, and then we followed the really good example that Santa Cruz City Schools set and allowing during the current distance learning setting, where we have a cohort of staff children being supervised by classified staff in a safe and stable small cohort. So we're just continuing to engage in the conversation to see how we can, because it's a tough job to have to deliver that instruction and serve as a parent as well. So we're going to continue to keep them in mind as we move forward.
I'll just add to that I think it's very important that we bring compassion and empathy as a driver for every conversation that we have with parents, not just parents who are teachers, but all parents who are struggling through these difficult times. I also think it's very important with our parents who are teachers to not try to box into a one-size-fits-all approach, but to be resilient and flexible, because family design, setup, size, and situation is very different. So as an example, there's some teachers for whom it's very high value and important to be delivering distance learning from their classroom right now and want to be in their classrooms, where there are other parents who are teachers whose family dynamics are much better suited to them delivering at home. So I think honoring labor and parenthood by listening and being flexible and resilient to what teachers tell us they need to be able to do their best is a part of having a heartful leadership. I sometimes say to my team, I think you need my heart right now as much as you need my head or my brain. And I think in the case of teachers who are parents, that's particularly important.
Thank you so much for those answers. One of the questions is related to what happens if a student gets COVID. We had a question both in English and in Spanish. And I'm going to ask for our Director of Safety again, Jennifer Busing, to share with us what is the protocol when a student who is in attendance is found to be a positive case of COVID-19.
Yes, exactly. And it is likely, as we know, that students might test positive when they don't have any symptoms at all, or if a student has some symptoms and a family member keeps them home, a doctor might recommend that they get tested. And we might be surprised that we have more students testing positive. Again, contact tracing would begin, and school officials would immediately begin communicating with public health. Or perhaps public health, maybe immediately communicating with us, depending upon who finds out soonest, and contact tracing would begin. A positive case, that student would be requested to stay home, and they would need to isolate, and then contact tracing would begin, and likely that cohort or their classroom, family members would be notified that they would be also quarantined at home. Those students that may have been exposed, they would need to be watching their symptoms. And so we are expecting these cases to happen. There are going to be positive cases in students and staff and parents and family members. And I think we're going to have to get used to being flexible and resilient because some of this isn't returning back to normal. It's going to be returning back to even being more flexible.
I would also like to share that we have had some cases of positive cases for some of the schools that have in-person services. And that we follow the protocols that we described in terms of communication, in terms of isolation, and we haven't been any outbreaks that have taken place. And so this is something that we do, as Jennifer Busing mentioned, it is something that we would anticipate. And that's why it's so important to have both the preventative steps that we're taking and also having systems in place to respond if a positive case is identified. Additional questions, Sage?
Can you tell us a bit more specifically about what school plans are for increased sanitation?
So a lot of research has come out that has shown that getting COVID-19 from inanimate objects is actually not something as likely as it once was considered early on in the epidemic. However, our protocols for disinfecting have not changed. We take it extremely seriously, and part of the protocol is to ensure that we're using EPA-approved cleaning agents that are rated for COVID-19, that we are disinfecting all of our schools on a daily basis, that we're making sure that any kind of surfaces that are being used, such as, let's say, a Xerox machine in a staff lounge, would be disinfected before and after use. And so the protocols, we have room by room protocols for cleaning and disinfecting for our school campuses. And our schools have spent a lot of time and effort in getting equipment, getting cleaning agents, and getting training for staff, and of course protective equipment as well, to ensure that we're able to provide the cleaning and disinfecting process for our schools. And that is one of the components of our review of the schools to ensure that they're ready for in-person services and for staff being on campus as well.
Could you tell us a bit more as well about contact tracing and how it would work in schools?
So contact tracing is the responsibility of the Santa Cruz County Public Health Office. And that basically is to identify anybody who may be a close contact to somebody who has COVID-19. And so when somebody in the community or in our school community is identified as having COVID-19, it begins a process, and I'm going to ask Director Hall to give us a little bit more detail about that. But in terms of ensuring that we make basically a list of anybody that may have come into close contact with that person, to ensure that we let them know that they were in close contact and that they may have to quarantine for 14 days as one of the steps. And so that process would involve the schools, and that we would, since the person may be on the school community, perhaps the person who has COVID-19 got it at a social event the previous weekend, we would want to know who they had contact with at the school site and we would investigate that piece to make sure that we're communicating that information both to public health and being able to ensure that everybody that was a possible close contact knows that they may have been a close contact with a positive COVID-19 case. We may recommend testing, and public health may recommend that they be isolated or quarantined. Mimi?
You want me to add anything to that? I have
Yes.
a couple of things that I wanted to say about testing and contact tracing. One is that Director Busing is exactly right. We're partnering with schools on contact tracing. However, one of the things that I wanted to highlight that she had mentioned is that a family is likely to know first about their child's test status before public health will. We will get it through the electronic lab reporting system, and there's typically a delay. So the family will be the first entity to know. And so it's so very important that if that's the case, you immediately notify your school district. And that way, the school district staff can get a jump start on, as you can imagine, every 24-hour delay is a delay in a time frame when more people can become exposed. So it's really important to be proactive about that. The other thing I wanted to mention is this is not unlike flu season. I've worked in public health through many school flu seasons. And in the county that I used to work with, we got reports from the schools on something called ILI, influenza-like illness. These are the reasons that we ask parents to keep their students home when they're sick. So this year, more than ever, it is incredibly important to, number one, get your flu vaccinations if that's something that you're open to doing. And then number two, be really, really aware of any symptoms that your children may be experiencing, and don't send them to school if they are symptomatic. So as far as contact tracing, it's a very specific process of understanding who you were around for how long during certain lengths of time. And can you imagine, most of us do so many things throughout our day that we can't remember every little insignificant thing that we did or who we were exposed to. So it's another reason why it helps to have stable cohorts of children, besides limiting the exposure of folks, because it really does help with contact tracing. And we have had a very, very difficult time in reaching out to folks and having people just remember where they've been and who they've spent time with.
Thank you so much, Director Hall. There's a couple of questions about partnering with UC Santa Cruz and why did we partner with Stanford instead of UC Santa Cruz? We actually approached UC Santa Cruz several weeks ago to see if they would be able to help us partner. And at the time, they didn't have the capacity to take on surveillance testing for the schools. That has since changed, and their capacity has increased significantly with the support of some support from the Public Health Office. But at the time when we did approach them, they weren't ready for that. We are talking with them, though, to help us with surge testing, and as they are the lab for a lot of our local health clinics. And so we know that UCSC is doing amazing work, and they've really amplified their test capacity. So we are going to be working with them to help us if we identify if we need to move quickly to test folks in our schools if there's a positive case.
How are schools continuing to meet the needs of meet the needs of our highest need students? And how are schools going to accommodate students when in-person instruction is able to expand for students who aren't able to wear masks or social distance, for example, special education students?
Anybody would like to pick that one up in terms of how to serve our highest needs students and how those needs are going to be continued to be met? Yep, please, Superintendent Monroe.
All of our districts are doing a combination of both virtual and the in-person supports right now for both academic and social emotional needs. We've been talking to other districts that are bringing in small cohorts and have reopened for hybrid, and what they're finding is that lots of concerns about students not following protocols isn't in fact a concern. That special education students can learn to follow the protocols, to socially distance and to wear masks. And we're going to be kind and empathetic and firm and supporting our students in learning those protocols so that we can keep everybody safe.
Thank you.
I can just add that we had the good fortune in SoCal over the summer before we really pivoted, before the data caused us to pivot to full distance learning only. We did an in-person summer school model that included special education students and general education students. And we were very gratefully surprised by how cooperative students were with all the safety protocols, including wearing masks.
Thank you. There was a question about wearing masks or face coverings and if it's going to be required. And the answer is yes, face coverings are going to be required in all our schools. This is something that the California Department of Public Health has put out some guidance, and our local public health authorities have reinforced that all students in our K-12 schools are going to be required, and staff, of course, are going to be required to wear face coverings. And that is something that is going to be required of them. There's a lot of questions here, and we're gonna keep going for another 10 minutes or so, and so thank you for all your patience as we get through this. What happens if? Oh, go ahead.
Oh, I was going to ask if it was okay if I answered one of the public health kind of testing questions.
Please. What is the question?
The question is, can a school inform their full staff when a student tests positive for COVID-19 if they withhold the name of the student? So I just wanted to explain how contact tracing works. And it really depends on the situation. There are very rare occasions when we would notify everybody if it was prudent, if it was appropriate, because that student had known exposure to a wide amount of people, then that would be the reason why. But typically, what we call an exposure notice is done to the people who have known any kind of exposure. And if there are those that don't have any risk of exposure or no known exposure, then there's usually not a reason to let everybody know. However, there have been cases in terms of workplace outbreaks and things where we have had to do that because people can't recall where they've been, or they have exposed such a large amount of people. So it really depends on the situation.
There is a question here about closing schools. What would be the criteria for the closing the schools? Now, there is some criteria that is set by the California Department of Public Health, but superintendents do also have the authority to, and our local public health officials do have the authority to be able to close, suspend in-person services or close the school, meaning that neither staff nor students are able to go as a result of local health conditions. That's our second criteria in our system. And the general kind of rule of thumb that the guidance from CDPH is to look at students who are in a cohort in a classroom. If there is a positive case, anybody who's in close contact, which in many cases would be that cohort of students, would have to be quarantined. And so that would be kind of the suspension of in-person services for those students, and they'd have to remain home at 14 days. There are some percentages that the California Department of Public Health has set. If 5% of your student population at a school site has developed COVID-19, then CDPH would require the closing of that school. However, in conjunction with our local public health officials, we're really looking at if there are multiple cases in multiple cohorts. If there's a concern that there is a spread that's taking place at a school site, then the local superintendent can make the decision with consultation from public health to close a school. And so it really is, we want to emphasize that we know what the standard is that is coming from the state, but we also are looking at local conditions and making sure that we can make a determination of what is the best course of action to ensure that we're keeping everybody safe. Is that Director Hall? Is there anything you want to add to that?
Sorry, I was trying to unmute. No, you covered that pretty well.
Great, thank you. There's a question about similar to that. If we go back to purple, I think that as much as possible, our focus has been on keeping track of the big picture stuff at the governor's level, but really we're looking locally. And so that local data is extremely important for our decision-making process. And again, that's why we are sharing information and coming together as a group, as a unified voice, so that we can be consistent within Santa Cruz County as well. Sage, you want to help me with another question, or if any of my colleagues have a question that they'd like to pick up from the chat?
There are a lot of specific questions about how cohorts will work and how hybrid instruction will work when there are more students in the classroom. Could you tell us a bit more about that?
I think that this forum is really a general forum for all our school districts. And I think that each school district and each charter school is really going to come up with their own specific plan for what groups are going to be identified for small cohorts and services and what hybrid is going to look like. And so I think that as the schools develop those plans, working with their school community, they're going to be rolling out those plans. And so a lot of the details are either being developed, or they are being developed, but they're different for each of our school districts. And so it's probably not a great time for us to be able to talk about all the different approaches and that our schools are looking at when it comes to what exactly, which cohort is going to be identified for services or what hybrid instruction is going to look like in January. But we did want to share that we are moving forward in this direction, and that the schools and the school districts are going to be rolling out information and detail about what that's going to look like, and you'll get a lot more detail soon.
What kind of support are you giving teachers to prepare them to be able to provide high quality hybrid learning?
Who'd like to pick that one up?
So I'll go ahead and start with that one. So we provided professional development to a lot of our staff members, not just certificated teachers, but a lot of our staff prior to entry. We also, as most school districts did, we took it, the first week entry was a modified schedule in order to be able to provide that support. And then now our actual schedule itself at the secondary level, it's occurring on Mondays. And in this elementary level, it's occurring in the afternoons. We have scheduled time when we're able to provide professional development to our teachers. What we're finding is the most important is what we call job embedded professional development. So actually training that's happening when they're working with their students, alongside their students, instead of pulling them out when they're pulling them out and needing to provide a substitute. So we're committed, and I know all the school districts have been doing significant work on the different platforms, the distance learning platforms. And I know that parents too, and the surveys that we've sent out have seen those improvements. So we appreciate the teachers for taking on the new work and staff for taking on that as well, because our instructional assistants, I would just want to put a shout out to them. Our instructional assistants and behavior techs, they also too are online with our students doing those Google Meets. And so we appreciate them really transforming and switching their work to support students.
This is Lori Bruton from San Lorenzo Valley. I would just like to add to that our classroom teachers are specialists in in-person instruction. They do that very well. And the transition from online to in the classroom will be a process, but they are well prepared to take kids on in their classroom and teach small groups because that is the work that they do every day. And so for many, many teachers, they look forward to seeing the kids and have the opportunity to restart again in their classrooms.
Thank you so much for those answers. Sage?
There's a lot of concern in the chat about just behavioral health support for students right now during this very difficult time. What kind of support is available now and will continue to be available going forward for them?
I think that's one of the biggest reasons why we are moving towards in-person services is because of the challenges that our students are facing. And so I think our schools really have done a great job of moving to provide as many of those behavioral health services online, but we also recognize that doesn't work effectively for all our students. And so anybody would like to share as to what the plans are for increasing and supporting students who are having a tough time? We know that our students are experiencing higher levels of anxiety, of depression and suicidal ideation. What are the kinds of things that we can do to support our students, or are we doing to support our students now and as we continue providing in-person services?
Well, I will just say that I think one of the most important things that we can do is continue very deliberate and thoughtful planning about bringing students back on campus. Even if it is a reduced number of minutes, it is really a quality versus quantity scenario. And one of the best ways to infuse students' sense of security, belonging, competence, empowerment, all the signs and all the markers of social well-being is their ability to congregate together. They need that. So bringing students back on campus with all the procedures and protocols we've talked about is probably the most central initiative to increasing a student TK through 12's sense of well-being, because they need to be with their peers and teachers. I like to say that there's education and there's schooling. So what they're getting right now is very hard work on the part of our educators to provide their education, to keep them up to grade level standards, to make sure that there's not a great deal of learning loss, that we're teaching parents to teach at home as well as teaching out of the classroom. But we're not doing a very good job of providing schooling, because schooling is all that intangible connectivity. It's events, it's collaboration, it's time spent together, it's PE outside, it's all the things that help kids feel their connective tissue to community. So in addition to very targeted and discrete services regarding behavioral health, I would argue that the number one thing that we can do to uplift the sense of wellness of our students is to find a way to, even if it's only partial days or every other day, to bring them back on school where they can experience their full schooling experience and all the heart and soul that comes with that.
Thank you so much, Superintendent Morgenstern. Anybody would like to add anything to that?
I would just say for districts that have counselors, I believe we've been working really hard, not just to provide support to students online via Zoom, but as students were allowed to come individually onto campus. I know counselors are meeting socially distanced one-on-one with students on an as-needed basis, or as parents and students have made that request, and they're looking forward to being able to address more students as we're able to bring more students onto campus.
Thank you. And I believe Superintendent Chamberlain.
Yes. At Live Oak School District, we have counselors at each of our sites. And one of the things that we started the year with, and we've continued to repeat in professional learning, is the opportunity for counselors to work with teachers and helping them to develop strategies for building that sense of community and belonging with their students. So building that into their day when they're on Zoom. Again, there's no replacement for in-person interaction with both your teacher and your classmates, but it's really important that that be part of each day in our classes. Our counselors also work with our teachers in identifying signs of trauma and how to respond to that. and how to be responsive when students are signaling that, you know, they're pulling back, they're not engaging, they're not participating. So we've also identified students who aren't attending regularly or doing assignments, like as all the districts do, and our counselors are part of identifying kids at tier 3, those who, like, regardless of teacher outreach and office outreach, still not connecting. What might be the issues and how can the counselor step in to provide additional support for the students? But again, I think I hear this in many of the comments, that there's definitely that deep concern for the social emotional well-being of students. So hopefully, as Ms. Morgenstern mentioned as well, that if we can have students return, that will feel normal again, and they'll really appreciate that time.
We are coming to the last part of our session today. And so are there any other questions before, maybe a final question before we kind of go to our closing?
Yeah, so I'm seeing a lot of duplicated questions in the question and answer section, but I'm also seeing a lot of questions that we're not going to have time to answer tonight. You mentioned earlier that many or some school plans to expand in-person services may differ between schools and school districts. What would you advise community members and parents? How can they best stay informed in this process and on school plans specific to their child's school?
Well, I think my colleague superintendents would agree that, and the leads of our charter schools, that the communication component of this work is extremely important to both having two-way communication with our parents, establishing forums where we're able to both listen and share information with our community. All our school districts have been conducting surveys, getting information about the needs of students. And I think that communication is extremely important. And so reaching out to your site principals, reaching out to your districts is extremely important right now. Find out where the schools are in their plans for the implementation of small groups, what the hybrid process is looking like, and provide feedback and input on that. Any recommendations from my distinguished colleagues here about what parents can do to stay engaged and participate in this process?
So for me, I think, and it's probably the same for all the school districts, is please try to keep your cell phone number updated in our system. And then please make sure that we have your email address, because most of us send out weekly, if not regular, communication. A lot of us do now text message blasts. And do communication that really is facilitated if we have your correct information. So if you can, in the school student information system, if you can make sure, if you change your email address or if you change your phone number, please give it to your school site or go in and provide us the correct information so we can communicate with you.
Thank you so much. Is there anything anybody would like to add? Anything to Dr. Rodriguez's response? All right. I want to thank you for joining our session today. Please know that we are deeply committed to supporting our school community, that we have come together as to speak with a common voice, both for our commitment to the safety of our students, our staff, and our community at large, and also our commitment to increasing in-person services. We recognize this is a necessary step for us to be able to continue to build those environments for students, those supportive environments for students that what they need, and to address the inequities that they have been experiencing since COVID-19 impacted our schools in March. And so I'd like to thank you all for participating. I wish we would be able to answer the over 130 questions that that we received today. Want to thank our superintendents, our charter leaders, Mimi Hall from County Public Health, everybody that's come together to share this information. I think that there's going to be ongoing communication and opportunity for the superintendents to continue to connect with their schools in the future. And so look out for information coming to you for your children. From your superintendents about your children and about the programs that are going to be being put in place for the next couple of months, as well as for January. Thank you so much for your questions. Thank you so much for your advocacy and your support. And we look forward to continuing the conversation and continuing to build safe and engaging environments for all our students. Thank you so much.